Dr. Stork, how has your practice been affected by the pandemic?
Well, I think the easiest way to answer that question is it's really slowed us down, at least lately. Initially, there was quite a bit of, as you might imagine, chaos in the sense of trying to understand which patients we could see, trying to contact those patients and get them rescheduled, trying to reassure cancer patients and patients with major urological issues that everything was going to be okay if we delayed their care for a few weeks. So after that initial thrust of activity, things have slowed down here quite a bit. We're doing a lot more video visits, a lot more telephone calls, and even getting a little research in here now and then.
What types of care are you currently providing, and which surgeries, et cetera, have you put on hold?
Yeah, so it's been an evolving scenario over here in West Michigan. As you probably read, Eastern Michigan, Detroit, and Ann Arbor have been affected by this virus much more significantly than we have, at least to date. So in late March, we were able to get in a number of cancer cases here locally in our community. We spoke with our surgical chief of staff locally on a daily basis as to whether we felt it was appropriate to do cancer cases, to do stone cases. And just kind of based on the way the virus is presenting in West Michigan, we had a nice window where we were able to bring a lot of those cancer patients in, get their surgeries done, and get them out of the hospital. Any stone patients that we feel are at risk of sepsis or at high risk of going to the ER, we've also tried to take care of as well. But I will say things have tightened up quite a bit here in the last week, and I think with the governor's orders and just the concern in West Michigan that we're going to start to see a spike, we've really tried to keep almost everyone out of the office, and we're really only doing emergency cases at the present time.
Have you been assisting in the care of patients with COVID-19?
Well, not to my knowledge, but like everywhere else in the country, at least initially, we really didn't have any testing. So we're not really sure what we've been exposed to. Fortunately, myself and my partners aren't showing any symptoms. I did have a partner who was in Vail and self-quarantined for a couple of weeks after being in Vail. So to our knowledge, we're not taking care of coronavirus patients per se. They've been isolated to a specific floor in our local hospital. As urologists, we've been taking a week of call at a time. I know my partner last week did see one patient in the ICU with a urologic issue, but beyond that, not to my knowledge.
How has the transition to providing telemedicine services been for you and your practice?
Well, it's an interesting question. You know, when I was a younger doctor, I could never understand how older doctors seemingly took a long time to get comfortable with new technology. But as I've become an older doctor, I'm starting to understand maybe why that's the case. Nonetheless, I think it's gone a lot easier than I thought it would. A lot of the barriers over here really have to do more with our patient population, our elderly patient population that sometimes doesn't have internet access, sometimes doesn't have email, sometimes can't quite figure out the instructions for how to do the video visits. So I would say in my practice, of the people that we try to take care of remotely, we've been able to do about 50% by video and the other 50% by telephone.
Mm, personally speaking, how concerned are you about the safety of your family, and what precautions have you been taking to protect them and yourself?
Yeah, I think this is a question that weighs on the minds of lots of providers, not just physicians, but nurses, all of healthcare. My family and I sat down in mid-March and had a discussion about this. I brought up the option of just moving out of the house, renting an apartment, or I have colleagues that are staying in RVs until the duration of this was over. And my family told me that they felt that we were stronger together. So I got to say that made me feel good and has added responsibility in my mind, with respect to what I do at work, the precautions I take, because anything I'm exposed to at work, I'm potentially bringing home. When I do come home, I immediately put my clothes in a separate bag. I jump in the shower real quick, shower longer than I normally would. And I'm getting fitted for a N95 mask next week. My partner just got fitted this week. Some of that has just been logistical.
That the mention of the mask leads me into my next question, which is what has the availability of PPE been like in your area?
Yeah, so fortunately, we've done well with respect to providers. That hasn't been an issue in our office, and because our volume at the hospital has gone down, as a physician, I haven't had problems. I know that the nurses here locally have voiced some concerns with administration about their perception that they don't have enough PPE. And I certainly understand that, and I understand their concerns. Although I would have to say that I don't think that the shortage of PPE on the west side of Michigan is probably nearly to the extent that it is in New York or Detroit or possibly even in Ann Arbor.
How have you been staying connected with colleagues, and what have you been hearing from other urologists in your own area and also across the country?
Yeah, so we are really a satellite of University of Michigan here in Muskegon. We've been having weekly phone calls with Ann Arbor to get a better idea of how we think the curves are going to play out here in Michigan. We've been having weekly phone calls with my partners because we're not really seeing each other anymore. We're really having one physician at a time manage the hospital work and to a large extent the office. So there's been a lot of phone conversations. I think we're all getting used to the multiple platforms to communicate with. It used to be email, now it's the epic haiku, Blue Jeans, Zoom. It will be nice when we all sort of settle on a single platform that we're all familiar with, but at the same time, we've got plenty of time right now to explore these different platforms. So it's all been virtual. I can't say that I feel isolated from my colleagues, other than it's nice to see them, obviously, when I can.
Sure, sure. Is there anything else that you would like to add?
I would just add that my area of research interest is in childhood trauma. And I think it's important for all of us at this time to be aware of what's going on in people's homes. We have been reading reports about increased incidents of domestic abuse, childhood abuse. Obviously, the current situation is stressful, and I think puts a burden on families that are living on the margins. So I think as urologists, when this starts to settle down, we're going to have to be extra aware of the stress that people have been through and will continue to be going through, not only emotionally, but also financially, the stress that they're under with respect to their medical conditions and the worries and the anxieties that they have about that. And equally important, the stress that our colleagues are going through and the stress that we're undergoing ourselves. I'm not sure really as urologists, we've all had a lot of training in how to deal with that stress, how to recognize it in others. I'm not sure that my generation really has been open to seeking support and help with anxiety, depression, and other issues like that. So I just hope that this unusual circumstance will bring us together in ways that maybe it hasn't brought us together before, and help us advance physician health and well-being in the future.